How can I help you, Andrew? What are you doing here?
I'm having a lower back pain.
Okay.
And a leg discrepancy in length.
That you know of?
Yeah, I feel it when I stand up. I'm kind of.
You tilt to one side?
Yeah, I tilt to one side.
And how long have you noticed that, Andrew?
Actually, I think it might have just started very recent, like maybe 3-4 months.
What happened 3-4 months ago?
I started getting pain in my lower back.
No trauma?
No trauma.
No slips, no falls, no accidents?
No.
So you woke up one day and you started getting pain?
Right, yeah.
Okay. And what happened? Tell me.
It started getting harder to get out of bed, bend over, or picking up something off the ground, or just bending over in general. I felt like very tight.
So can you stand over here for just 1 second, face this way, and just bend over like you're going to pick something? And is that how
right
you
there?
Okay.
That's right there.
And you're feeling it in the dead center there?
No, I feel it off to the left, lower left, and then like the glute also.
In the glute. Kind of like Harpreet. Okay, have a seat, please. So that started 3 to 4 months ago.
Yeah, like severe pain, yeah.
Okay. Well, we need to figure this out. Okay, and we had a little peek over there at what's going on, and we'll go through the whole case. So the main issue, just so we're clear, low back pain started 3 to 4 months ago that you're telling me.
Right.
Bending over, movements, painful, and is becoming hard to get out of bed.
Right.
Okay, are you still working though?
Much limited.
Okay, are you because of the pain?
Because, yeah.
And are you standing more at your job or sitting?
I'm more sitting.
More sitting, you're on a computer a lot?
Yeah.
Okay, so we need to talk later on about the ergonomics as well.
Okay.
Okay, about sitting and standing and exercise and things like that.
Okay.
Okay, anything else I need to know about you?
I'm thinking, this is just a thought, the duration of me going through this was probably in a car accident.
Okay.
That happened almost exactly a year ago.
What happened?
I got rear-ended.
Okay.
I didn't feel pain afterwards.
Okay.
But almost immediately I had digestion issues.
Right after the car accident?
Yeah, almost immediately after.
Okay, what does that mean you had digestion issues after the car accident?
I wouldn't go to the bathroom as much. I still would go, just not often.
Okay.
And I didn't link the two. I didn't think that had nothing to do with it.
Okay.
With that, and then seeing your videos, I thought maybe it does have something to do with it.
We'll take a look.
Yeah.
Okay, we'll take a look. There was a case, one of my first videos, exactly that. The guy got in a car accident, started developing because of mid-back injury, and started developing a lot of digestion problems. And people will say, well, how can you crack the back and fix digestion? And that's not really what I'm doing. What I'm doing is, what am I really doing here? We're making sure that the nervous system is functioning at its best. How do we do that? By evaluating the spine, making sure all the messages from the brain to the body are free of communication. And when there are kinks and twists in the spine over time can lead to nerve pressure. Wherever that pressure is will cause malfunction or dysfunction, and that produces a symptom. That symptom is labeled as a disease.
Okay.
So we're not going after symptoms and diseases as such, right? We're going after balance and symmetry. And if everything is functioning correctly, then what should be the outcome?
Everything else
It should be working right. There should be less pain or no pain, right? But
Right.
What's the reality? There's always something, right? There's some sort of ache or this or that. Okay, shall we get started?
Yes,
Let's
please.
go. All right, Andrew, these are your full spine x-rays. This is a picture in time. It tells us how you've evolved from birth. We have 24 movable bones in the spine. We have 23 discs in between. And then we have the foundation, which is the sacrum and the pelvis, right?
Right.
This is your side profile. On the side profile, we're designed to have 60-degree reciprocating curves. And we can see we don't really have a curve there.
Right.
We're going to talk about that. Okay, now let's go to this x-ray and let's figure out what's going on here. So, you've heard me talk a lot, Andrew, about the foundation, and the work we do here is based on having a level foundation.
Right.
And what's the first thing we see here? We don't have a level foundation, right? We have a tilt to that right, which is what you're feeling. So there's a short leg on the right. Now, what we need to determine in your case, is this a functional short leg or is it an anatomical short leg? And what does that mean? A functional means the short leg is due to alignment. Okay? A structural or anatomical is due to an anatomical deficiency. So in your case, what we need to do is we're going to measure your femurs and your tibias to make sure they're even, that you were born even. A millimeter or two here and there, I'm not too worried about. Okay? Now, let's go closer into the foundation and see. Okay. Well, this should start to make some sense now. Let's look at it. We have a measured deficiency of 26 millimeters, and I will say this is the largest one I've seen yet in my office. 26 millimeter measured deficiency. If we correct the pelvis, the PIIN6, the IN6 is like the AS, right? So when we correct that, it's going to bring the left side down, so it's going to bring the right side up, but it's only going to bring it up, the actual difference, 2 millimeters. So there's got to be an answer somewhere else. And we may need to do a heel lift. We may need to do that, and it's more than likely. We just got to figure out when and how much to start with. Okay? Now, we have a PIIN, we have a rotated sacrum. We got a couple of different injuries here. This isn't it happened a year ago from a whiplash. This is not I woke up 3 months ago, I'm sorry. These are multiple injuries you've had in the past. Whether you remember, you're going to tell me at some point on this journey. Now, this is what's happening in your foundation. Left pelvis goes down one, okay, and turns in to the left. Left dimple turns in. So guess what? Your foundation is actually favoring to the left side. You have a rotated sacrum on the right. There's a disconnect. So your pelvis wants to go left. Your sacrum wants to go right. We have a short leg there. And one more time. Pelvis wants to go left. Sacrum wants to go right. And which way does the spine want to go? To the right. So there's a complete disconnect in that low back. So guess what those muscles are going to do? They are going to spasm. And we need to talk about what a muscle spasm is. There's a big, big misconception out there of muscle spasms. I have a video. It's a little boring, but it's called Dr. Rahim Chiropractic 101. I'll probably have to redo it, but all the knowledge is there. And I go through what are called spinal defense mechanisms. The body has 5 major defenses to protect the body to protect the nervous system at all costs. First line of defense is spinal curve, 60-60-60. Let's go back to this to show you something. And I'm going over a lot of information. If I'm going too fast, stop me or ask me. Okay, there's just a lot of stuff there. Okay, spinal defenses, 60-degree reciprocating curves. If we're looking at both of these, what's more important? Sure, we want a level foundation, but we need these curves. I'm okay if there's a little kink here and there, right? My job is not to straighten a spine. My job is to help the people and help you understand what's out of balance, get the foundation right, and help you get these curves back. Okay?
Okay.
All right, let's continue, please. So what's a muscle spasm, and why does the muscle spasm? The muscle spasm as a protective mechanism. It's like a splint. So if you injure yourself, you sprain your ankle, what does it do immediately? It swells. Yeah. It swells to protect. And that's the exact same thing with the muscle spasm. So the way I was trained and the way I've educated patients and people over the past 18 years, if you have a muscle spasm, it's telling you there's instability. And if there's instability, figure out that instability and put ice on it right away. I don't heat a spasm. I ice it. Okay, the next question then becomes hey, I need to soften it up to adjust the person. Right? I need to e-stem it. I need to ultrasound it. I need to break up, do some massage and make it nice and soft. There's not really, that I know of, a Gonstead doctor that does that. And the reason why Gonstead was very specific in what he was doing and what the intention was, here's why, or here's how. That spasm is from instability, we said. So we find the nerve pressure, let's say it's your L4, L5. Then the idea is we want to get that adjusted, and that spasm or whatever is there is going to hold the adjustment. You loosen it up too much, nothing holds. It takes longer, you need more visits, right?
Okay.
And the idea of it holding may or may not hold the adjustment. That's what I've seen in practice. It doesn't mean whatever other people are doing, that's on them. Okay, I'm just telling you what I do. Okay, does that make sense?
Makes sense, yeah.
Okay, let's continue. Let's go back to the foundation we said. So we have a measured deficiency on the right of 26 millimeters. We have a rotated pelvis on the left. We have a rotated sacrum on the right. But if we go deeper now, we can see the bend here in the sacrum. It's right there.
And that's supposed to be straight.
No, because look, you have 6 millimeters of sacral inferiority.
Okay.
So this is defined as a sacral malformation. This is from old childhood injuries. Or you were born like that, one or the other. If your parents really don't remember a fall or trauma way back when, then you were born like this. Look, 6 millimeters sacral deficiency. So now let's look at that. If we're able to correct 6 from 24, we're now at 18. You follow me?
Yeah.
Okay.
So it's still going to be a...
So we're probably going to need a heel lift, okay, for true correction. But I don't know yet. Let's see what we find on it.
Okay.
But does that make sense?
Makes sense.
All right, let's continue. Now, when we look here, so we've stabilized the foundation. It's going to be somewhere in the sacrum and the pelvis, or the pelvis. Then from there, you can see the body wants to favor to that right side. It then wants to do what? If it didn't compensate, where would your head be? Way over here, right?
Yeah.
So what does the body do? It compensates to bring it back. And that's based on what we call, or what's called, the righting reflex. Have you ever heard me talk about the righting reflex?
I don't think so.
I'm a zoologist from my undergrad, so I studied a lot of evolutionary biology. And what I'm talking about here of why these compensations happen, the righting reflex, it is innate to all biped predators. We're biped predators. We're on 2 feet. We're predators. Our eyes are in the front. Prey have their eyes on the
side.
Yes. Biped predators. So the body will do everything and anything to maintain the head straight and eyes level. Head straight, eyes level. You've seen people like this, right? You've seen people like this. They're tilted on the side, maybe.
Oh, maybe, yeah.
Okay. I'm sure you guys have seen people. I'm not talking about the guy like this.
Yeah.
That's not what I'm talking. I'm talking about the person who's listing to the side, but they're always looking like this. They're not like this.
That almost sounds like me.
That's the okay. So that's the righting reflex. Okay.
Yeah.
People want to know, where does that come from? Okay. Let's continue. So what's going to happen here? These ligaments get short. These get loose. The muscles have to guard. So we have mid-back tightness.
Okay.
Okay. Let's continue. Now it wants to come back to center, and it does it all the way to here, right?
Mm-hmm.
So from here to down there, that's all compensation. That's all compensation. All right, let's continue. Let me go to this X. Let me zoom in. All right. So we will figure out on you where we're going to start. Then you see it comes back to neutral right about here. If I find stuff in here, obviously if there's nerve pressure, I'll deal with it, but the fix is the foundation.
Right.
Okay. Then we have some jaw deviations, a little bit of that right jaw. Okay. Again, we'll deal with that stuff later. That's not primary. Okay. Does that make sense so far, sir?
Yep.
Okay. And we have a little bit of deviated septum I can deal with for you as well. Okay. For the breath. Perfect. You get the nose job.
All right, cool.
All right, cool. Now, let's zoom in here. Here's the other thing. We're looking at 5-4. It's a little light. I get it. Okay. But we don't have clear joint spaces. This is all curvature from compensation of that short leg. It doesn't mean these are all degenerated. It's just the wrong view. You're looking at the side profile. They're tilted. Check it out. Side profile, and they're tilted. That's what you're saying. Okay. Now, let's go down into the tailbone and see where's that injury. There it is, dude. Look. Should be a smooth curve. You got 1, 2, 3. You had 3, 2 for sure. Third possible falls on your sacrum. Now, so your discs are still good overall. Now, when you're saying herniated disc, L4 right there, it's misleading. And I talked about it before. I'll probably edit this out, but I'll just briefly go over it. It's based on a non-weight bearing MRI. Okay, you were lying down.
Yeah.
So there's intersegmental and global motion is the concept. This was defined by White and Punjabi, clinical biomechanics of the spine. Each bone moves a certain amount, right? They've already quantified it. Global motion is the whole thing goes down and comes back up. So if one segment is stuck, 3-4 segments have to compensate to make up that movement.
Right.
The stuck joint doesn't move. Put them on their back, stuck joint didn't move. The hypermobile segment moved. That's what we say. Your mid-bad discs are all good, and here's the best news. Your neck is great. So even you got whiplashed or rear-ended, right? Mm-hmm. Your neck survived. Fantastic. Okay. Now, last thing, and we'll get started. Flexion extension. Here's where your issue in your neck is. So flexion extension films, they should all move forward and back together. This is flexion. That moved forward, that moved forward, that moved forward, that didn't move. Did that move forward? That's still stuck back. Do you see that?
Yeah.
But look at it this way. It's normal. You see? So we do these stress views to show there should be the movement. And it's very clear. That 6 ain't moving. C6 is the shoulder, the arm, the brachioradialis, the beer drinking muscle, the biceps, right? Okay. All that stuff. That's all C6. Okay. Any questions on this, sir?
No.
Okay. Why don't we stand up, watch you walk, and get into the exam, though?
Okay.
So, this one is down here. And this one is up here. And I'll have you walk a couple of times back and forth for me, Andrew, towards the nervous system, posterior and back. So your body has compensated well for this. We definitely got the side wiggle back and forth, but they are also moving. Let me just tuck this in, please. Now you can see the side to side with it. Keep walking, please. Okay, march in place in the middle of the room, right there, march in place. My hand is right behind you. Okay, close your eyes, keep marching. You can see that he goes more to that right side now. Yeah, I feel that. Okay, open your eyes. Okay, Andrew, let's start with you by measuring your tibias and your femurs to rule that out, make sure they're even. Okay, so what we're doing is we need to measure tibias and femurs. Let's go ahead and bend both knees, please. And the first thing I'm going to do is let's measure the tibias. Basic measuring tape. Let's start on this side. We're at the knee joint, and what I'm doing here is I'm going to use number 1, so we'll subtract 1 from the measurement to 18 and a quarter minus 1 is 17 and a quarter. On the right side. On the right side. On the left side, 18 and a quarter minus 1, 17 and a quarter. Your tibias are even, sir. Let's go ahead now and check femur. Now, for the femur, we'll go on the side, greater trochanter. Use number 1, and we're going to go right to the joint space there. That's 20 1/4 minus 1, 19 1/4. Okay, now let's go to this side. Greater trochanter. Everyone has different marks, landmarks. Just be consistent in your landmark. Same thing here. Greater trochanter. 19 1/4 minus 1. They're even. So this is coming from those traumas, dude. Okay. All right. Sit up for me and let's start the exam. Starting at the base of the neck. And the first thing we're getting is C6, left side, 7, 8 points. Yep, C6. Alrighty. Family knows you're here?
Yeah.
What did they say? Good luck?
Yeah, good luck. That's all they could say.
I mean, fair enough. Fair enough. Now, we also had some digestion issues going on there, okay? We did talk about it in the consultation. I can go over that more later on the x-ray, okay? But the focus right now is let's focus on that.
Right.
T6, 7. Left side, 5, 6 points. More like 7. You like your carbs and your sugars?
Oh, yeah.
Oh, yeah, that's that sugar button. Now, let's go a little bit.
So, do you know that because of inflammation or because of the meter?
What's that?
The
digestion?
yeah.
From the x-ray. The Megan Blvd, the gastric air bubble is small on your x-ray, and there's the permeated mouth appearance. There's a lot of undigested food going through the gut, and it's producing a lot of gas, correct?
Yeah.
Now, when I get to here, he's got a lot of swelling in here. This is swelling, by the way.
Okay.
I got to actually tilt the scope. So why do we tilt the scope? If there's bilateral pressure, then tilting the scope, it's comparing the top one to the bottom one. And it's down low, dude, S3, S4. It's down here.
My elbow?
Yep, S3, S4, T7, C6. Those are the 3 majors that I'm finding on the meter today. Sit up straight, please. Feet together, open and close the knees, and let's check the pelvis. Good, and right there on the PSIS's, right side only. When he does the right, the left shifts. Left side only. And does the left side, right side is fine. Scoot back for me a little bit, please. Now we need to determine, are we doing left pelvis or sacrum? Okay. And before that, let's statically palpate. Head down, please. Round your back slowly. Someone had asked me in a comment, why do I only statically palpate on the left side? Shouldn't I be doing the right side also? Sure. I start on the left to get an overall feel. And look, it's right there. The tissue changes, the swelling, orange peel, it's there too. I can already see it. If you want me to, I can do it so you guys can see it as well, but I can already see it when I'm doing it this way, that it's there. This whole thing is swollen. Okay, sir?
Okay.
And it's right there.
I don't know if it helps in any way, but not long ago, if I would have tilt my head down, I felt pains in my leg.
Shooting down?
Yeah.
Okay, that's good information, sir. 1, 2, 3, 4, 5, 6. Number 7, tender. Number 6, little bit tender. More there.
Yeah.
Yes?
Yeah.
6, 7. Right there.
Yeah.
7. Okay, let's continue. 7. He's very red. He has the hyperemic response. There's a lot of redness just from palpation and scoping. Means we're dehydrated or thiamine deficient. I'm going to assume you need to drink more water.
Yeah.
Yeah.
Probably it.
Okay, same thing. All this is swelling. All that. And you can see it goes right into that tailbone right there. Now, let's go back down here. L5, back towards me. A little tight, yes?
Yeah, it's tight.
S1, a little tender.
Yeah.
S2,
Yeah. It's
more tender. S3,
Yeah.
right there.
Yep.
Put a curve in your back.
Ah.
You see? That's where you need to be. Now I'm going to let go. Okay.
Okay.
S3, T7, and now let's check the neck. Sit back for me, please. 7, 6. There. Bend left. You crack your neck, don't you?
Yeah, I do.
Yeah, you do. How do I know that? Because it's there, C6, it's tight, it's stuck, but you're very flexible up here. That's someone who pops their neck a lot. All right, right there. 6, 7, S3. Okay.
What do you think?
C6, the neck. T7, and the sacrum. Okay.
Sacrum, lower back, right?
Sacrum. S3 is this foundation, is the tailbone. With that drop leg on that right side, we need to get a good torque into that, okay, to help free that up.
Okay.
After that, you'll walk, we'll recheck, and then I want to work on your ankles today.
Okay.
Okay? Questions?
No.
Shall we get started?
Let's get started.
Let's do it. We have C6 with a little bit of inferiority. And 7, 6. We want to get right underneath it, okay? So distal palmar surface of the index finger on the inferior lateral aspect of the spinous. Tuck the chin, stack the vertebrae, get underneath it. Slight lift, feet out resting on your heels, please. Palms up resting on your thighs. Stack. And we just want to get right underneath and lift. And he's very flexible because of all that cracking he does. There you go. That wasn't a crack, was it?
No. Oh, it was a light one.
It was a light one. Let's go face down over here. It was more a set. We're not trying to crack everything.
Okay.
I want to get right on that 6. Chin up, please. Lift your head. There. There. Gotcha. Did I hit your chin on that?
No.
Okay, perfect. Then we're good. 2, 3, 4, 5, 6, 7. Nice and easy, sir. Home run. S3, slightly on the right, and torque. Nice and easy. We got to relax those shoulders for me. And that's the home run. Gotcha. You okay?
Yeah.
And let's walk it out a couple of times. Not so bad, was it? A little different though than what you.
Yeah, I feel
Okay.
like lightheaded.
Okay. Walk it out. You did eat, right?
Yeah.
Okay. Walk a few times. And take some smaller steps and all the way over. As you're walking, is anything different in the back there?
Yeah, I feel like pressure kind of. There's no pain. Well, there is very little pain.
Keep walking. Have a seat. Let's continue. Let's run the meter on his back. Let's see what we find now. That cleared your C6. C6 is clear. T7 is clear. Now, what's going to happen with you, things are going to be shifting all over the place. You're probably going to get different feelings in different parts of the body as things shift out, okay? Still got more of the sacrum, not enough. You okay?
Yeah.
Good. Good. Palms face up. That's the rest. All right, sir. Walk that off one more time, and we'll continue. As you're walking, tell me if anything is different on your feet or your hip.
Yeah, I feel less weight on my left ankle, which I usually feel a lot of weight on.
Okay. Come back over here, have a seat, and let's recheck that low back. This is sitting normal right now?
Yeah.
You're not trying, correct?
Correct.
Good. A little bit better there, Shasha.
Mm-hmm.
Cool. Let's see. Good. Now there's heat. There's no break. It's just heat here. This thing is trying to guard right now. Now let's palpate. L5 back towards me, sir. L5. S1. S2. This is the one I did.
Oh, it feels better.
There. S3 is different?
Yeah, it's just different.
Good. Okay. Now, let's do the buff and polish on the low back. Work up some of that scar tissue. May I continue, sir?
Yep.
Okay. Ears. These are just tune-ups now, okay? And shoulders. Nope. That's it. Let's go on your back. So from all of that, Andrew, and lying down, is lying down different right now?
Yeah, I feel more leveled.
Okay. Raise your right leg. AS talus. Raise your left leg. AS talus. There you go. Go ahead and sit up for me, Chris. You have any questions for me, sir?
No.
Do you understand what I found, what I explained?
Yeah.
Okay, and you're clear on it? There's no questions on that component?
No.
Okay, let's shake your hands then. Stand up. Squeeze. Squeeze. Squeeze hard. So I'm just feeling that everything is seated properly. Squeeze in the wrist and the elbow. We're off a little bit on the radial head and the distal radius. Lunate. Squeeze. Relax. There you go. Squeeze. Good. Squeeze. Stand back over here where you were. Let me close the back up. And you get to bend forward like you did before the visit. And see if there's any difference.
Yeah, I could go lower.
Less pain?
Less pain.
Let's see one more time, please. Good. All right, sir. Welcome to the office.
Thank you.